Anatomy of the hand. Complete hand anatomy explained. Bones, muscles, nerves and tendons. Hello everyone, and welcome to this complete guide to the anatomy of the human hand. The human hand is one of the most remarkable structures in the body. It allows us to write, create art, play musical instruments, lift heavy objects, type on keyboards, perform delicate surgical procedures, and communicate through gestures. Every movement of the hand depends on a complex interaction between bones, muscles, tendons, nerves, ligaments, joints, and blood vessels. In this video, we will explore each of these structures in a simple and easy to understand way. Let's begin with the skeleton of the hand. The human hand contains 27 bones. These bones are divided into three main groups: the carpal bones, the metacarpal bones, and the phalanges. The 8 carpal bones form the wrist. They are arranged in 2 rows and provide flexibility and stability. Their names are the scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. These small bones work together to allow smooth wrist movements such as bending, extending, and rotating. Next are the 5 metacarpal bones. These long bones form the palm of the hand. Each metacarpal connects a wrist bone to one of the fingers. They provide strength while allowing the palm to maintain enough flexibility for gripping objects. The fingers are made up of 14 phalanges. Each finger has 3 phalanges known as the proximal, middle, and distal phalanges. The thumb is unique because it has only 2 phalanges, the proximal and distal phalanges. This shorter structure contributes to the thumb's exceptional mobility. Now let's examine the joints of the hand. Joints are where bones meet and allow movement. The wrist joint connects the forearm to the hand and enables flexion, extension, side-to-side movement, and circular motion. The carpometacarpal joints connect the wrist bones to the metacarpals. The thumb's carpometacarpal joint is especially important because it is a saddle joint. This special joint allows the thumb to move in multiple directions, making it possible to oppose the fingers. Thumb opposition is one of the key features that gives humans excellent hand function. The metacarpophalangeal joints, commonly called the knuckles, connect the metacarpals to the fingers. These joints allow the fingers to bend, straighten, spread apart, and come together. The proximal and distal interphalangeal joints connect the finger bones to one another, allowing each finger to bend smoothly. Now let's move on to the muscles of the hand. The muscles responsible for hand movement are divided into 2 major groups: extrinsic muscles and intrinsic muscles. Extrinsic muscles are located in the forearm. Their tendons extend into the hand to produce movement. These muscles generate powerful gripping and finger movements. Flexor muscles bend the fingers and wrist, while extensor muscles straighten them. Intrinsic muscles are located entirely within the hand. Although they are much smaller than the forearm muscles, they are responsible for precise and delicate movements. These muscles help with writing, typing, buttoning clothes, and handling small objects. The intrinsic muscles are grouped into the thenar muscles, hypothenar muscles, lumbricals, and interossae. The thenar muscles are found at the base of the thumb. They allow the thumb to move in different directions, including opposition, which enables us to touch the thumb to the fingertips. The hypothenar muscles are located at the base of the little finger. They control movements of the little finger and contribute to a firm grip. The lumbrical muscles flex the knuckles while extending the finger joints. This unique action allows us to perform fine motor tasks with precision. The interossae muscles are located between the metacarpal bones. They are divided into dorsal interossae and palmar interossae. The dorsal interossae spread the fingers apart, while the palmar interossae bring the fingers together. Now let's discuss tendons. Tendons are strong bands of connective tissue that connect muscles to bones. They transmit the force generated by muscles, allowing movement of the fingers and wrist. The flexor tendons run along the palm side of the hand. They bend the fingers whenever we make a fist or grip an object. The extensor tendons run along the back of the hand. They straighten the fingers and help release objects after gripping. These tendons slide through protective sheaths that reduce friction and allow smooth movement. Without these sheaths, tendon movement would become difficult and painful. Next are the ligaments. Ligaments connect bones to other bones and provide stability to the joints. They prevent excessive movement while maintaining flexibility. Collateral ligaments are found on both sides of the finger joints. They prevent sideways movement and stabilize the fingers during gripping. The transverse carpal ligament forms the roof of the carpal tunnel. This ligament holds the flexor tendons in place as they pass into the hand. Now let's explore the nerves of the hand. The hand receives its nerve supply from 3 major nerves: the median nerve, the ulnar nerve, and the radial nerve. The median nerve passes through the carpal tunnel into the hand. It provides sensation to the thumb, index finger, middle finger, and part of the ring finger. It also controls many of the muscles responsible for thumb movement. Compression of the median nerve causes carpal tunnel syndrome, one of the most common nerve disorders affecting the hand. Symptoms include numbness, tingling, weakness, and pain. The ulnar nerve supplies the little finger and half of the ring finger. It also controls many intrinsic muscles of the hand that are responsible for fine finger movements. Injury to the ulnar nerve may cause weakness in grip strength and difficulty spreading or bringing the fingers together. The radial nerve primarily controls the muscles that extend the wrist and fingers. It also provides sensation to part of the back of the hand. Together, these three nerves allow us to feel touch, pressure, pain, temperature, and vibration while coordinating precise hand movements. Now let's discuss the blood supply. The hand receives oxygen-rich blood mainly from the radial artery and the ulnar artery. These arteries join together to form the superficial and deep palmar arches. Smaller branches extend from these arches to nourish the muscles, bones, skin, tendons, nerves, and fingers. A healthy blood supply is essential for healing injuries and maintaining normal hand function. Let's now understand how all these structures work together. When you decide to pick up a cup, your brain sends signals through the nerves to the muscles. The muscles contract and pull on the tendons. The tendons move the bones across the joints while the ligaments stabilize the movement. Blood vessels deliver oxygen and nutrients to every tissue involved. This perfectly coordinated system allows smooth, controlled, and accurate hand movements. Now let's look at some common hand injuries and conditions. A fracture occurs when one or more bones break due to trauma or excessive force. Fractures may affect the wrist, metacarpals, or finger bones. Sprains occur when ligaments are stretched or torn. They often result from twisting injuries or falls. Tendon injuries may prevent a finger from bending or straightening normally. These injuries often require surgical repair. Carpal tunnel syndrome develops when the median nerve becomes compressed within the carpal tunnel. Repetitive hand movements, pregnancy, diabetes, and wrist injuries can increase the risk. Arthritis affects the joints of the hand, causing pain, stiffness, swelling, and reduced mobility. Osteoarthritis and rheumatoid arthritis are among the most common forms. Trigger finger occurs when a flexor tendon becomes inflamed, causing the finger to lock or catch during movement. Taking care of your hands is essential. Regular stretching, strengthening exercises, proper posture while working, and avoiding repetitive strain can help maintain healthy hand function. Wearing protective equipment during sports or heavy work also reduces the risk of injury. In conclusion, the human hand is an extraordinary example of biological engineering. Its 27 bones, numerous joints, powerful muscles, flexible tendons, stabilizing ligaments, intricate nerves, and rich blood supply work together in perfect harmony. This remarkable design allows us to perform everything from the strongest grip to the most delicate movements with incredible accuracy. Understanding the anatomy of the hand not only helps us appreciate the complexity of the human body but also improves our knowledge of injury prevention, diagnosis, and treatment. Thank you for watching this complete guide to the anatomy of the hand. We hope this lesson has helped you better understand how the bones, muscles, nerves, tendons, joints, ligaments, and blood vessels work together to create one of the most versatile and useful parts of the human body. Stay curious, keep learning, and we'll see you in the next anatomy lesson.